And I'm Walter Kernan. I'm a primary care physician at Yale School of Medicine, where I'm an emeritus professor of medicine. Um, Finally, I want to mention lifestyle. Since the 2014 guideline, the American Heart Association has developed Life's Essential Eight. So this is really a simple, very effective guideline for patients and clinicians. The Life Essential Eight, as you know, includes diet, physical activity, smoking, sleep health, weight, lipids, blood pressure, and diabetes. In this guideline, we recognize that there have been advances in managing lifestyle factors contributing to diet, particularly to stroke risk, particularly diet, sleep, uh, obesity. With respect to physical activity, there are still no randomized clinical trials which show that physical activity reduces stroke risk, but there is better evidence to show the effectiveness of physical activity for improving risk factors. We still follow guidelines to recommend all adults achieve about 150 minutes a week of physical activity. But we include a new recommendation to screen all adults for their physical activity, and we provide some guidance for how to do that. It is now also a class of recommendation 1 to counsel patients against excessive sedentary behavior. It's known that sedentary behavior, sitting around not doing very much, is associated with increased risk for cardiovascular disease and stroke. So that's new. I'd also just like to point out sleep. There is growing understanding that sleep disorders, sleep impairment, manifested by poor duration of sleep or quality of sleep, affects cardiovascular risk. While there's no direct evidence that improving sleep reduces stroke or cardiovascular disease, there's a lot of indirect evidence that sleep is associated with better risk factor control.